My name is Wolfe, and I am a sports medicine specialist at Teco Orthopedics. A sports medicine specialist is somebody that uses arthroscopy as a tool to operate on certain joints. The most common joints are shoulder and knee. But there's a little bit of a misnomer with sports medicine itself. Most of the patients who I see actually aren't sport or athletes who get injured. There's repetitive workers, repetitive weekend warriors who get injured. I do a lot of rotator cuff repair work, and most people who have rotator cuff problems are middle-aged or older. While they still may be competitive in sports, it doesn't actually make me a so-called sports specialist in that regard. But nevertheless, we do take care of a lot of athletes, and a lot of athletes have shoulder and knee problems. So of the joints that I take care of, the shoulder and knee is the most common. So do all of my patients require surgery? The answer to that is no. In fact, the majority of the patients that I see in the office do not require surgery. Most of the things that I see are aches or sprains or strains of muscles. Most get better with time. Some require physical therapy. I also see a lot of arthritis in my office, and not everybody who has arthritis requires surgery. I was asked by a company to participate in designing mostly some of the instruments that were used for the reverse total shoulder replacement. The particular replacement that I use and also a member of the design team is designed from a company in Gainesville, Florida, and I was actively involved with design rationale as far as instruments were involved for the implant. I traveled to France to operate with one of the lead design physicians in their surgical arena, which was not only educational for me, but very fun for me as well. I was raised in a farming area. My father was a mechanic and my mother was a teacher. So learning was very important for me, and with my father being a mechanic, we got nothing new. Everything was fixed. So as I went through my education, I developed a love for anatomy, and as it got closer to college and of course medical school, I was drawn to orthopedics because that's what we do. We fix things. So as I look back at my upbringing, that's definitely why I got into what I do.